Okay, welcome everybody. This is the GSSA Applying to Otolaryngology panel. Just a couple points for tonight. Our agenda is going to be a couple minutes of introduction. I'm going to introduce each of the panelists, and then they'll talk about any specific projects or partnerships that they may have right now. And then we'll move on into 30 minutes of questions and discussion, and then we'll take questions from the registration form and live from attendees. So let's get started. I'll start by introducing Dr. Rolvix Patterson because he's on nights right now, so it's really great that he can join us. He's a recent graduate from Tufts University School of Medicine and a PGY1 Otolaryngology-Head and Neck Surgery resident in the NIH-funded T32 research track at Duke University Hospital. He aspires to be an otolaryngologist and global health researcher, and his formative experiences include co-founding the Global Otolaryngology-Head and Neck Surgery Initiative, living in Haiti while working at St. Boniface Hospital, and serving as a Paul Farmer Research Associate in Harvard's program in global surgery and social change. Thanks for coming and being with us tonight.
Thrilled to be here. Thank you.
Do you want to share anything in particular about what you're doing right now?
I am working nights on general surgery right now. Just started residency, so getting used to that. And then on the research side of things, we have a lot of exciting stuff going on with the Global OHS initiative that I'm sure you'll hear a lot about since we are all members of that.
Good. I'm really excited to hear more about that. Next is Dr. Stanford-Moore. She is a third-year resident at UC San Francisco. Prior to her residency, she earned her medical degree from UCSF and a master's in epidemiology from the University of Cambridge in the UK, where she focused her research on otolaryngologic pathologies in resource poor settings. During medical school, she lived in Kenya conducting research on HIV and AIDS. And as an undergraduate at Berkeley, she spent time in Vietnam and Spain. In 2020, she was selected by the American Academy of Otolaryngology, Head and Neck Surgery as one of 2 international outreach delegates. So thank you for joining us tonight.
Yeah, thanks so much. It's fun to be here and fun to be here with colleagues that I work closely with. I think it's really cool that global ENT has such an interest because it's a relatively new part of ENT, and we're all very passionate about that. I think in general, attending at one of these sessions means that everybody's starting off on the right foot because it's all about networking, seeing what other people are doing in the field, and just reaching out to people in your department and other departments to see how you can get involved in not only global ENT, but a lot of global surgery work in general. So it's really cool to be here and meet like-minded people.
Yeah, that's great. I think we're really excited to hear about all of your paths and how we as students can emulate those and get more involved. Next is Dr. Zhu. She is a PGY5 in the Department of Otolaryngology-Head and Neck Surgery at the University of California, San Francisco. She studied outcomes of pediatric malignancies at Butaro Cancer Center in Rwanda during her time at Harvard Medical School. She is currently involved in the Global Otolaryngology Head and Neck Surgery Initiative as well, just like all of our panelists. So welcome, Dr. Zhu.
Yeah, thanks so much. Yeah, I echo what Gaelen and Robbie both said. I'm really excited to be here and looking forward to connecting to other people as well.
Okay. And finally, we have Dr. Wasserman. He is also an ENT surgery resident at Massachusetts Eye and Ear Infirmary, Harvard Medical School. Originally from New York City, he studied Russian and Eastern European studies at Yale University before going on to earn an MPH in health policy and global health at the Yale School of Public Health. He went down to New York to earn his MD at Mount Sinai School of Medicine, and finally, he had the privilege of serving as a Paul Farmer Research Associate at the Harvard program in global surgery and social change as well, just like Dr. Patterson. So welcome.
Thank you, Sierra, and thank you for the organization for organizing all of this. Like Robbie, I'm adjusting to intern life, and I think one of the major themes that will come out throughout this session is the ebb and flow of keeping these interests alive, sort of as your time is spoken for or less spoken for, and it's been really exciting, actually, to figure out how do you balance these interests and long-term projects and make these connections and learn from these different services and these different people and the attendees at events like this. And so absorbing all of that has been sort of, I think, what Robbie and I are up to right now.
Great. We're really excited to be hearing from everybody, and thank you for joining us and taking time out of your schedules to be here. So we'll go ahead and just jump straight into it. The first question is, can you give an overview of how research time looks like in your subspecialty right now and the most common ways that people use them? So some programs have years off, some in the short term, long term, and some pursue masters or fellowships. So we'll start with Dr. Wasserman. Go ahead and tell us about that with you.
So, as you go around the country looking at ENT programs, everyone will advertise what research looks like at their institution. Do they give you 3 months twice during your 5 years, if it's a 5-year program? Do they give you just a 4-month block and that's it? Do they give you a month every single year? And there's all these different ways of doing it. And what I'm really quickly learning is, having a defined block of research is lovely, I think. I haven't obviously experienced it yet, but it's about how do you prepare yourself to hit the ground running for those 3-month block when you have a block, and how do you find time, the interstitial time, to do research that isn't as codified in a research block. So I think it's both preparing yourself to take advantage of whatever time your program gives to you, and but also figuring out how do you make those connections in the operating room with mentors or outside of the operating room on your own time. And so for us, we are one of the programs that typically do 3 months for 2 or 3 years, in addition to our research resident, who has 2 protected years of research.
Great, thank you for that. Dr. Zhu, what about at UCSF? What have you experienced there?
Yeah, I think I'd say above all, residency in general is just really hard to do research, especially during rotations, because it's pretty exhausting. But I'd say the couple of lessons that I would say I've learned from being a resident, trying to set things up. So at UCSF, we have a 3-month block of research during our 4th year. And especially with global health projects, if you want to be on the ground, you have to be spending a couple of years in advance setting it up. So during my research block, I set up a study looking at head and neck cancers in Tanzania. And it took me almost 2 years to get that IRB written and through the international and local IRB. So doing projects on the ground, I think, take a lot of time to set it up. I'd say things that I wish I had are things such as a global OH&S initiative, where I'd say many ENT programs around the country are, I'm curious what other people think. I think are really excited about global health, but don't necessarily always have the infrastructure or don't have a mentor you can just pop into a project. And so I've had to reach outside of our department for that. But with the global OH&S initiative, it's been really exciting because you can plug into a project pretty early on, even without your own department having the infrastructure, which is really awesome. So yeah, I'd say lessons are, definitely things take a lot of time to prepare for, and initiatives like this are kind of nice for students and trainees who may not have that infrastructure in their home institutions. Gaelen could probably talk a little bit more, but our home institution, UCSF, is very strong in global health. We have a lot of faculty who are very supportive, but we don't have someone we can plug into and hit the ground running. So it takes some time and work to set things up.
Yeah, that's great. It's good to hear that you used your dedicated time for that work in Tanzania, but it does take a long time to set those up. Dr. Stanford-Moore, could you speak a little bit more about your experience with UCSF and also about the OH&S initiative?
Yeah, sure. I think, like Mary said, we have a 3-month dedicated block here at UCSF, and it's really not about, as a resident, doing global research is really about how you can be in your home city doing research that can be impacting things you're passionate about, because it's so hard to set things up and you don't have time to go abroad. So it's nice and it's awesome that Mary has kind of paved the way in our department for going abroad during that research block. But I'm now in my 3rd year and trying to set up, just even from intern year, identifying mentors and saying, do you have data that I can work on? Do you have similar passions? Can we come up with projects that I can do from afar? Has been a good learning opportunity for me. And I think medical students are invaluable in that. And in my experience doing research in general, as a resident, it's so hard to do projects with our time commitments, but utilizing medical students who are passionate about similar projects, I have found to be invaluable. And so, people watching this today, I think, feel free to reach out to any of us. The Global OH&S Initiative really came out of a group of people that were passionate about global surgery and were going into ENT and trying to find a way to carve out dedicated research group with similar passions while we were all based in our home residency programs. And so Mary, Robbie, and Isaac have all been heavily involved in this and trying to get this going. And one of our main aims is to collaborate with international ENTs from around the world. So not have this be based out of the United States, but I think a theme in global surgery in general is how to make the most impact where it's needed and how to get input from the people in the countries where they're looking and seeing what is needed, what can we do to help, and how we can do that from afar or on the ground. And so the unique thing about the Global OH&S Initiative is we're about 50% high-income country participants and 50% low and middle-income country ENT, both trainees and attendings. And so we have these awesome discussions in our research meetings that have input from all over the world. And so I've really found that to be really inspiring.
That is really inspiring. Thank you for sharing. What a great initiative. Dr. Patterson, do you want to talk about what your experience has been at Duke?
Sure. Looking at residency programs, the opportunity to do global health research really was an important aspect for me. I want to be both an otolaryngologist and a global health researcher. So traditional residents at Duke typically get 3 months, which I think is increasing to 4 months of dedicated research, similar to other places. And I think one of the benefits here is that there are faculty who are already deeply involved in on-the-ground research, which might lower some of those barriers of setting up projects yourself, because it allows you to kind of jump on things that are already ongoing and are already probably much bigger than what you'd be able to accomplish on your own in 3 or 4 months. There's also the option to do a T32 residency, which is the NIH-funded program that can give you either between 1 and 2 years of funded research time. It depends on the school. Duke's is 18 months, whereas like Miami is, I think, 1 year, and Mass INER is probably 2 years. And so that can give you a more dedicated way to do global health research. I think it's important when you're looking at those programs to understand that they are very different depending on what school you go to in terms of what opportunities will be available. And a lot of it is dependent on what faculty you have. So I think it's important to, if you're thinking about a T32, to look at the faculty, see what kind of projects they're doing, and see if any of them are involved in global health work. My experience was that only a handful of schools would be able to support like real global health research through the T32 program. But it's just another avenue to get involved in that kind of work.
Okay, great. It was really great hearing about all those avenues for research for students as they're thinking about applying to residencies, including those tracks, the T32 track, and getting involved with OH&S in residency, and also as medical students, watching for the stuff that comes out of that. So what did all of you find most important when looking at residencies, and how strongly did you consider support for global surgery when you were choosing your program? We'll go ahead and start with Dr. Wasserman again.
Well, so Rob and I are both very, very sort of recent to those kinds of considerations. And for me, it was a combination of wanting to try my hardest to surround myself by people who I could imagine wanting to sort of be similar to in terms of stitching together their interests, both clinically, but also academically. That's not to say it's not possible to carve out your own niche and work extraordinarily hard to, align these resources. And, I wanted to say if I had to, if I could have my way, I'd rather things be sort of around me so I could bring together these different resources. But for me, I think the most important thing was just this culture of people understanding and respecting the idea of what it means to do global research, without any pretense that I would be able to do the kinds of research that I wanted to do at all times. I went in eyes wide open, knowing that, residency, I imagined, had an ebb and flow to it, and that I might not be able to do that kind of work from day one, but I wanted to at least be around people who understood and respected those kinds of questions and that kind of sort of service, so that I could keep those interests and those skills alive, so that I could finish at the end of 5 years and still, be involved in the kind of work that I wanted to do. And finally was looking for an institution that was larger than just the program, right? Maybe the program didn't have the resources or the people, but could I be in a city or an institution where I could lean on the law school, for example, or a school of public health? And so thinking a little bit broader, again, without any pretensions that I'd be able to lean on them at all times, but knowing that those people were around was important to me.
That's great advice. And Dr. Patterson, have you had similar experiences with that?
Yeah, I definitely had similar experiences and thoughts as Isaac going in. I think it's definitely a hard thing to decide, like how you rank your interests and the things that are important to you going into residency. Obviously, global health and the global ENT research is something that I care a lot about. But I think first and foremost, you are in residency to become a surgeon. And some of my mentors have highlighted the fact that, in order to create space for yourself to do research and global health work down the road, the best thing you can do for yourself is to become an excellent surgeon. And so choosing a place that will, do that first and then have all of these things, all of these additional considerations around you, I think is a valuable way to approach it. And I think also just doing a lot of research on who is at the university, who might be able to facilitate you working on projects or jumping into projects that are already ongoing, becomes very helpful, both in your interviews as well as, just your general understanding of the programs.
Just a clarifying question, when you say who's at the university, do you mean ENT researchers that are already doing global health, or maybe just other surgeons doing global health in general?
I think all of it is important. If you can go to a residency program, know the people who would be there to make global health happen for you. I think it's important that can equip you to, perform well in your interviews and make this case for what you want to do by pointing to specific people who are already doing it at the university. I think one of the challenges that I encountered at programs who didn't have much global health infrastructure, didn't have people there doing any sort of global health research beyond maybe mission trips, was that it was really hard to paint the picture of what I wanted to do to them. I would be like I want to do research on global health. It's really like public health research, looking at health systems and how ENT care is delivered. But there just wasn't an inherent understanding of that at some places. And so I think it's important to be able to point to people and say, hey, I want to do it like Dr. Emmett's doing, or what Dr. Lee's doing, or even people in other departments, just because it helps, make these kind of abstract ideas concrete. Because this is a really new, I think, approach to ENT, and something that isn't understood at this point everywhere.
Right, that's a great consideration, going to a program that kind of has that foundational understanding of what global surgery means. Dr. Stanford-Moore, did you, what influenced you to choose UCSF?
I think kind of Robbie alluded to this, but in choosing a residency, that's kind of a whole different seminar. But most important to me was the culture and the people and the surgical training. And I think we're all passionate about global surgery and we're all passionate about global health, but in reality, there's only really a handful of programs that offer opportunities in ENT. You have to choose a residency that's a good fit for you and your training. And I think if you're passionate about global health and global surgery, you carve a niche for yourself and you figure out ways to collaborate. Mary and I both happen to be interested. And really, when I started residency, Mary was the only other person in our department who was interested. And so we really formed a bond. And I said, what are you doing? I want to do it with you. And then we met Isaac and Robbie by going to the Academy's humanitarian meeting at the Academy meeting last fall. And this is how the global OH&S initiative really came about, was meeting like-minded people at different programs. It wasn't really about UCSF. And we are lucky that UCSF has a foundation of global surgery in the general surgery department and in the anesthesia department and OBGYN. So we do have resources at our disposal, but I think in choosing the program that's the best fit for you, you have to think about, everything in combination and then just meet like-minded people. Now Zoom is so much more tangible.
And Dr. Zhu, it sounds like you forged a path for yourself at UCSF. So if you could speak more to that and choosing a program that maybe had global surgery influences elsewhere. At UCSF, there's a really strong global surgery program, but not necessarily in ENT.
I'd say a couple of things. I think one, like I echo probably what everyone's probably said already, but like one, the field is changing so much. Like when I went to college, there was nothing. I've always been interested in global health and oncology. And there was no such thing as global oncology when I went into college. And then by the time I graduated medical school, when I started, there really wasn't global surgery. And then when I graduated, there was a Lancet commission. And now, like going into residency, there's no global otolaryngology. There wasn't really global otolaryngology the way that there's global surgery. And now, like about to graduate, we have that now. So I think it's rapidly changing. I think I would echo what other people says. When I was applying for residency, I asked a lot of mentors, like, what do they think about different programs? Like, am I interested in global surgery? Where should I go? And multiple senior mentors would always say, be a good surgeon, and then you can figure out the research later. And kind of echoing Gaelen, I think, like, residency, I think, like, probably the best advice is, like, regardless of where you go, residency will suck sometimes, like really bad. Like you will have days that you're like, I just want to go back to bed. And like, you're like, I hate call. And so if you can find a place where you enjoy, even on your worst days, going in and seeing the people or seeing your co-residents, I think that's ultimately how you should choose your residency, because day in and day out, your main work, the majority of the time you're doing things, you're going to be hanging out and working with people. So I totally echo, like Gaelen said, I love our residency. I love our co-residents. Like even on my worst days, I like going in and seeing my co-residents and hanging out with them. And I think that's by far way more important to your like daily happiness and sanity than finding a good place for global surgery, even though that's really important. That's why we're here. But find people that you like being around.
Just as a follow-up question to that, how did you determine that UCSF had your type of people? And what information did you ascertain from the program to ensure that that was a right fit for you, culture-wise, and that the people around you were similar to you?
I try to think of where would Gaelen Stanford-Moore be in 2 years, and then I went there. No, I think it's hard in the Zoom era because you don't get to see the implicit, like the non-spoken feel of a place. But I would say, if you get interviews at places, reach out to the residents from those programs and talk to them, because there's a lot of things that people will say to you explicitly and a lot that they won't say explicitly, but you can kind of like infer from their answers and from their tone. I'd say that's probably the best I can give in the Zoom era. I just did it with head neck fellowship. So I think reaching out to people as much as you can and listening to what they're saying, but also like listening between their words and, getting a sense of what a place is really like is probably like the best that I got in this Zoom life.
Does anyone else have anything to add to that about what they wish they would have ascertained from programs when they were applying, or the best way to see if a program's a good fit culture-wise?
I think, regardless of the COVID situation we have now, if you do a sub-I is the best way to know. And people have mixed opinions on sub-Is, and you can ask your mentors that at your home institutions. But, a 1 month rotating internship in a program that you don't know is a really great way to see people on their worst day and their best day and see if you like it.
Okay, our next question is about very similar to what we're already talking about, but many teaching hospitals have global surgery centers or initiatives that span across all of the sub-specialties. I kind of touched on this briefly about UCSF having a global surgery program already. How do you recommend students connect with these centers, or did you connect with these centers when you were applying during their virtual interviews? let's start with Dr. Stanford-Moore.
So UCSF actually has a brand new Center for Global Surgery and Health Equity, and we have a brand new chair of global surgery as of July 2020. So this wasn't around as much when I was applying to residency, I wouldn't say. But I knew that the global surgery department, the global anesthesia department, I should say I'm biased, I went here for medical school, so I'd already interfaced with a number of the programs here. But I knew that they were doing global health work, and I had done global health research in Kenya, for example, as a med student in a different department. And I think, you know, in that way, reaching out to other departments that have global health interests was the way that I kind of found a niche within UCSF. And now I feel very grateful that we do now have a Center for Global Surgery and Health Equity that Mary and I have both participated in. And we offer a global health curriculum here. I think a number of different academic centers around the country have these kind of certificate pathways and different residency programs. We have one in global health in particular, which is multidisciplinary, that Mary and I will both be participating in September, where we'll attend lectures with anesthesia residents, OBGYN residents, general surgery residents, and kind of get more of a didactic interface of the history of global health, and then have a mentor where we can work on projects ourselves and what our interests are.
That's great to hear. Do you want to talk more about that program, Dr. Jude? Do you want to add anything to that?
Like Gaelen said, it's really new, and I think probably the oldest or well-known program is the PGSSC program for global surgery and social change at Harvard that Robbie and Isaac both had been a part of as a medical student. And so I think UCSF is not mirroring, but kind of following in the same kind of path of multidisciplinary research focus group. Yeah, I don't know if Isaac and Robbie, if you guys want to talk about PGSSC, because I think that's a great opportunity for medical students.
Yeah, absolutely. Let's hear about that next. Dr. Patterson, do you want to start?
Sure. Do you want to hear about PGSSC first, or about like Duke Global Health, or both?
Let's do PGSSC and then we'll do Duke.
Sounds good. So the program in global surgery and social change is a program within the Department of Global Health and Social Medicine at Harvard. People are typically familiar with Paul Farmer. He's the chair of that department. And then John Mira, who is an OMFS surgeon, is in charge of this program. The goal of the program is to conduct research, advocacy, and policy to advance access to surgical care across the world. And it's set up, I think, in a pretty cool way. There are a number of faculty affiliated with the program. And then, you know, anywhere between 8 and maybe 10 or 11 fellows who are trainees from different surgical subspecialties who spend between 1 and 3 years at the program doing research. And then there are about an equivalent number of research associates. So those are medical students who typically spend 1 year with the program, like Isaac and I did. And I had a really positive experience there. They work in a number of different countries. It varies from year to year, but I would guess between like 7 and 10 countries every year, conducting a range of projects, including work on national surgical plans, all the way to like actual implementation of interventions and analysis of interventions in different countries. So I had a really positive experience working with the Haiti team, and also got to spend some time in India with Isaac's team as well. And I think, one, it taught me, you know, the basics of doing global surgery research, as well as the importance and how you can translate that into advocacy and actual policy change, which I think is the important part of the research.
Dr. Wasserman, do you want to talk about PG? And then we'll go back and we'll talk about Duke.
And so I, you know, just briefly to add a little bit, I think to expand on the end, which is the sort of the political aspect behind all of it. I think that was one of the main sort of aspects of these national surgical, obstetric, and anesthesia plans that came out of the Lancet Commission 2015. And I think the PGSSC, you know, as Robbie said, is really good about, through all of its, you know, clinical level research and implementation science, it's always asking the question, what does this look like politically? What does this look like to make this sustainable, not just from an equity standpoint, but from sort of a long-term historical and political standpoint? And so it brings together a lot of different interests in terms of the faculty, the medical students, and the research fellows who come in. And there's sort of a little bit of a niche for everyone, but it forces you to expand your horizon. You're not just asking one question. And, you know, I think that's part of the appeal of global surgery is you are forced to ask larger questions than you alone can answer. And the PGSSE pushes you to find the people who can, you know, do the best to answer this in a sustainable and equitable way.
And then in terms of otolaryngology, I was actually going to go into general surgery before my PGSSC year. So I'm very thankful to the PGSSC for opening my eyes to ENT. But there are opportunities to do ENT specific work. There's at least one faculty member there, Blake Alkire, who helped set up and lead the global OHS initiative as well, who can facilitate that kind of research and work. And there have been others in the past. And I think there was a lot of flexibility, at least in my experience, in terms of what projects I got to work on. And so I got to participate in some of those ENT specific projects.
Was it mentorship from Dr. Alkire that caused you to make the switch to ENT, or something else in that year that was impactful for you?
That was a big part of it. And then also, you know, just realizing how nice and cool and down to earth all of the ENTs were. And then I also had some time to shadow, which I hadn't really had up until that point in medical school, shadow some ENTs. And so just the combination of all those things pushed me in that direction.
Are there any other programs that you guys know of that have Oto faculty dedicated to global surgery? And what programs are they? Open to everybody.
You want to talk about Duke, Robbie?
Yeah, I can. Duke definitely does, and that was a big reason for wanting to come here. Susan Emmett is an otologist. She is actually largely a researcher. She probably practices an average of 1 to 2 days a week. She runs hearing loss related like screening studies and interventions in rural Alaska, and has also worked internationally. She has NIH funding for that. We have a head and neck surgeon, Walter Lee, who is also affiliate faculty with the Duke Global Health Institute. We have strong support from our chair for all of this kind of work. Other schools that might not be covered by the other panelists, I found that Miami was actually very encouraging of global health work, and I know that they do some work in Latin American countries and Haiti. They have a T32 that would allow you to do global health specific research. Sorry, getting a page. And additionally, I found Emory to be, you know, very positive about global health work. And I think at Emory in particular, and Miami, you get, I think, a really good local experience of global health through like Grady Memorial Hospital, in addition to the kind of research support for specific global ENT work.
Okay, other programs are Vanderbilt. Dr. Netterville is really well known in the field, and he has a really strong connection to, I think, Kenya, Uganda. So they go quite often for surgical camps, and he does a lot of projects looking at training, like an ultrasound, local like screening in Kenya, for instance. University of Pittsburgh doesn't have anyone faculty that I know, but they have a lot of international connections, and they've been interested in setting up a global academic surgery type position, or kind of with that interest. MD Anderson has a lot, though not residency, has a lot of like global connections, and runs a lot of international trials. So they have a lot of international connections as well. And I think, Gaelen, you might know University of Washington in Seattle probably has a fair amount of people.
Yeah, some of our attendings fellowship trained at University of Washington, Seattle. I think we kind of mentioned this earlier, but going to a university that has a strong public health department really helps foster a lot of global health research. So University of Washington Seattle has a big school of public health. Hopkins has a big school of public health. I don't know particularly in their ENT department, but that would be something you could tap into. And then I know Stanford has an interest in global ENT, and they have some faculty that do mission trips. But when I interviewed there, they also seem supportive of kind of carving out this new niche of global ENT research.
Yeah, and I think at Hopkins, Wayne Koch is the attending that has like a longstanding connection with Cameroon. Like I think he helped set up an educational program there. The other place that comes to mind is University of Michigan. I think Dr. Prince has also had a like a longer term connection with Ghana and setting up like education programs there as well.
And I'll just talk about Mass Eye and Ear and then Mount Sinai, where I went to medical school. So Mass Eye and Ear has a few attendings that sort of span the spectrum of sort of head and neck oncology to facial plastics that do regular sort of trips, but also studies examining the impact of those trips and how to, engage with communities to seek care and to support them more than just the surgical missions that they themselves participate in. And as Robbie and I talked about earlier, there is crosstalk across the sort of institutions with MGH and the Brigham to lean on some of their support as well. At Sinai, there's no one from an ENT perspective other than a new hire, Dr. Kirk, who has an interest in global surgery, but there is a strong institutional commitment to global health and understanding that now includes global surgery. And so that's sort of, I think, something that's on the up and up and something that the department is beginning to value more and more and beginning to put protected time for their faculty there, which is a new and a hard thing to do in New York City.
And one other person is Joshua Wiederman. He's a MD, pediatrics trained. Everyone's nodding because he's part of the initiative, but he just joined faculty at Mayo. And after he graduated residency, he spent 1 to 2 years in Ethiopia helping set up their residency in ENT. So he just joined faculty at Mayo within the past month, and he's probably going to be a really great resource for any students interested in Mayo.
I'm sure everyone's really happy for hearing those connections and hearing those resources at those different programs. Since you're all involved in the new Global OH&S initiative, I just wanted to give you guys an opportunity to speak about the goals of this group, what measures are being taken to complete these goals, and how medical students can get involved, or how you'd like medical students to reach out and get involved. We'll go ahead and start with Dr. Zhu again.
I was going to say, Robbie, do you want to take that? Or I see Holly, one of the members on the attendee list as well. Robbie, do you want to have a go at that?
Sure, I can start the discussion about this. I'm going to have to drop off the call here in a second, unfortunately, for a consult. So yeah, the Global OH&S initiative, Gaelen kind of already described some of the origins of it at the Academy conference last year. But we really created it because there was an absence of, a unified effort to conduct global research on otolaryngology. If you look to like neurosurgery or pediatric surgery, there are well-formed groups that have, outlined some of the basics of global pediatric or neurosurgical care. Like we have estimates of the number of neurosurgical providers, the global burden of disease, and other kind of key pieces of information that you need to even begin creating policy and programs to fill in the gaps. In ENT, we have kind of like a haphazard literature on a lot of these topics, but there's no real global understanding, of how many ENT providers there are, of the scope of the burden of ENT disease. There's been a lot of work done, particularly in hearing loss and head and neck cancer, but outside of that, it's pretty sparse. And so our goals with the Global OH&S initiative are to create an international representative group of students, trainees, and providers who are dedicated to filling in these knowledge gaps so we can begin to address the issues and access to care. Like I think it's something like 1 billion people have like mild or moderate hearing loss. Over 500,000 people die every year from head and neck cancer. So we're hoping to, through this initiative, create a systemic or an approach that addresses these issues at a systemic level. And it's, it's pretty low barrier to entry at this point. We are very welcoming of anybody who wants to join in the group. You can just email our Gmail address, globalohns@gmail.com. And we have bi-weekly meetings with the large group, and then other meetings for the different project teams going on. And yeah, we definitely encourage people to participate in it. I think it's important to highlight our commitment to equity though. And so we certainly do have research projects that are available for people to get involved in. But throughout, as we place people in projects, we really are trying to ensure that there is adequate representation from people who are either in low and middle income countries or in the countries that the research is conducted in. And so that might end up limiting some of our opportunities as high income country members of the initiative to do a lot of research, but there should be some opportunities still.
No, I think it's great for us to all hear that you guys are committed to equity, even within the field of research with in your own initiative, that's something that you're going to stand for in the beginning. Dr. Wasserman or Dr. Stanford-Moore, do you guys want to add to talking about the OHS initiative?
I just put the email and the Twitter handle in the chat function. Hopefully everyone can see that. But I think Robbie gave a great summary, and that the Twitter kind of highlights some of our more recent publications, but we have tons of different projects, and everyone's welcome to come and drop in on any of our meetings to hear about what's going on. I just was having a thought, I don't know what other panelists think about this, but as far as finding programs with global health, something that I've found was programs that have a county hospital system. So Robbie and kind of alluded to Grady Memorial at Emory, and we have San Francisco General here. And I know Mass Eye doesn't necessarily rotate at a county hospital. They happen to have a great academic global health program, but in general, county hospitals that have Department of Public Health funding have public health interests and potentially funding as well. And so that's something also to look at when you're looking for public health related programs.
That's fantastic advice, and actually something I've never heard of. So thanks for sharing that. This is our last question before we start taking questions from the registration form and live from attendees. But what are some of the challenges specific to the field of otolaryngology in the field of global surgery, within global surgery? We'll start with Dr. Wasserman.
I mean, I think it's something that has been sort of eye-opening to look at as we sort of start this organization together and we start trying to address some of these knowledge gaps. It's easy to say, oh, we haven't done these scoping reviews that some of these other specialties have. And I think, I for one have started just sort of appreciating, just how easy it is to fall into different silos within, otolaryngology, head and neck surgery, and that there's different specialists who look at different parts of the field, and how do we bring that all together? And that's something that feels somewhat trite and cliche to acknowledge in 2020. We sort of that's the buzzword of 2020, but sort of seeing that and appreciating that has been, I think, eye-opening for me, and then sort of beginning to try and think creatively as to how do we get around that problem. It's not as intuitive as I would have hoped or thought it was before sort of seeing this organization start to go through some of those hurdles.
That's really interesting to hear. Dr. Stanford-Moore, do you have anything that you want to add to that about challenges specific to the field of otolaryngology? Sorry, I muted myself halfway through.
Yeah, I think otolaryngology, head and neck surgery, is unique in that a lot of our pathologies and surgeries that we do are very based on quality of life. And historically, global health surgery and research was based on quantity of life and thinking about major trauma and life-threatening illness at a young age from infectious disease. And so there's been kind of an uphill battle to say that this is a global health and human rights issue and health equity to provide access to anyone around the world for pathologies like hearing loss, which doesn't necessarily limit the number of years that you're alive, but does affect your disability life years. And I think a number of ENT-related diseases have a similar kind of metric in how we get people access to the same care so they can have the same quality of life that someone in a high-income country would have access to.
That's a fantastic point. Dr. Zhu, do you want to add anything?
Yeah, I definitely agree with what you both said really eloquently. I think I think the challenges in global OHS is probably very similar to the other fields of global health. It's just hard to get the data, and the data we have isn't great. And also, I think our field is unique in the sense that we overlap with many other fields like plastics and oral surgery. And so understanding head and neck surgical care amid a landscape where we share a lot of diseases and pathologies with other subspecialties has also been really interesting to navigate as well.
Great. I'm really happy to have heard everything that you guys had to say tonight. For everyone tuning in, feel free to put questions in the Q&A and we'll answer them as they come in. The first question from the registration form is, how much of your work is divided between pediatrics and adult ENT? And have you found more need or action in one or the other regarding global surgery? And we'll start with Dr. Wasserman.
I'm assuming that question is mainly from like not a residency standpoint, but more from like a research standpoint. I think, you know, it can be biased. We have some extraordinarily strong pediatric otolaryngologist voices in our organization that I think open at least my eyes to the sort of pediatric burden of disease. And I think from sort of a global health standpoint, I think as we make this transition from global health to global surgery to global OH&S, a lot of that narrative has somewhat been told from the pediatric standpoint, and there's sort of like a lot of parallels to making connections to other pediatric conditions that already have movement and momentum. And so in terms of thinking about how to convince or sort of get buy-in, I think there is a history of that with pediatric conditions where, as has been mentioned before, for a lot of adult onset conditions, it may be more quality rather than quantity, or the quality is later in life rather than from the outset. So I've personally seen that it's easier from a narrative standpoint to start with the pediatric parallels.
That's an interesting point. Dr. Zhu, do you want to add anything to that?
Yeah, I think when you were talking, Isaac, I definitely think it's really fascinating how to tell that global health narrative. Like, it's easier to tell it if there's some story already told. So for instance, like you said, the pediatric side, or for my interests are in cancer. So global cancer is a narrative that's been told because it's built upon the non-communicable disease narrative. But yeah, for sure. It's like, I think all areas need focus. Like, I think there's a need in regardless of what subspecialty people look at, but in terms of like funding and like all that, it's easier to sell a narrative if a narrative has somewhat already been told before.
Interesting hearing about buy-in when you're talking about building a narrative in order to find funding for these opportunities. Our next question is, how did you pursue global research opportunities during medical school, and how did this influence your selection of a residency program? We talked about the second part a little bit already, but if you could talk about your global research opportunities during medical school, and we'll start with Dr. Stanford-Moore.
Sure. At my medical school, we had a summer vacation between first and second year, which is the time that people explored kind of research interests. And I explored different faculty members that had projects. In choosing global health work in particular, I think the mentor was more important to me than necessarily the project. I think that speaks to research in general, that if you have a mentor that's dedicated, already has funding, can really show you the way, that makes your life as a medical student a lot easier when you don't quite know what you're doing yet. And so I found a mentor in the infectious disease department that was studying HIV in Kenya and had some things on the ground already running and was happy to have me on board. And so I was passionate about East Africa. I'd grown up there a little bit with my dad's work, and she had some cool projects. And so that was a great kind of welcome to, I was at UCSF and I got an introduction to the global health research here through those projects.
And Dr. Wasserman, what did your undergraduate medical education look like in terms of global surgery?
I just have to emphasize to start with, before I forget, Galen's point of mentors and mentors who respond, right? It's like you can have a person who like is perfectly in tune with your interests and have funding and like might not have the bandwidth to respond to your email. And if you're that first year medical student and you're like 3 months between first and second year, and this is a mentor who's perfect on paper but doesn't have the ability to sort of meet you, that's a really tough, it's tempting to want to go down that route. And, you know, it's something that I think we've all been tempted by, and finding someone who is responsive to email. It's banal, but like everything, especially as a young medical student. My background was in Russian studies, and I used to live in Russia. And so I came to medical school knowing I wanted to keep that world alive. And I knew I didn't want to just do an 8-week trip during a sort of a break during the year. And so for me, global health and global surgery looked like looking at home first. It was looking to East Harlem in New York and understanding that, you know, the impact that I wanted to have of what was global about it was just looking up and realizing that there are more patients than fit into your clinic schedule or on your OR schedule. And they exist in Boston, they exist in East Harlem, they exist everywhere, they exist internationally, and the same sort of political and historical factors drive that here as it does there. And so for me in medical school, it was saying, you know, I don't have the time to go do the kinds of global surgery work I want to do abroad. How can I start that here at home? And keep those themes alive. And I was lucky enough to be able to then take a year with the PGSSC to do the kind of sustainable international work. So that was my approach throughout medical school.
Wow, that's great. Dr. Zhu, what did your medical school research and interest in global surgery, how did that come about?
Yeah, I definitely think I want to reemphasize like what Isaac and Gaelen said, which is like plug into somewhere. Don't try and start anything from the ground up. I think there's more learning to be done when you like plug into a mentor and plug into a bigger system. So for me, I'd been interested in oncology. And so at Harvard Med School, they have a close tie with Partners in Health. So they set up the Butaro Cancer Center in Rwanda. And so I had always wanted to have more global experiences. I just never had like finances or time to do it or whatever opportunities. So for me, in med school, I decided I want to take time off. So I took a year off and spent time at Butaro Cancer Center. I had a mentor, but probably not like as like a one-to-one, as you know, as strongly. I had like a conglomerate of a couple mentors, but I probably didn't follow Isaac's advice. Like I followed more of the topic than the mentor, but I still learned a lot. And I think looking back at the experience, what I appreciated was plugging into a bigger system and seeing how people who dedicate their lives to global health do it and how they think on a bigger picture scale.
Wow, fantastic answers with that. Our next question is, in this time of pandemic, how can medical students be involved with global surgery or health domestically as international travels are restricted? Okay, Dr. Zhu, do you want to start with this one?
Yeah, I think all of us would probably say join the Global OHS initiative. Yeah, I mean, I think as a medical student, if I had to do my life over again, I would probably do the PGSSC year. And it didn't exist, but I would definitely join the Global HNS initiative or like initiatives like that. There's so many groups and so many resources now that literally were not a thing 5 years ago. So, you know, just being connected with these kinds of ideas and these like organizations and all this energy and enthusiasm, I think honestly eventually, fingers crossed, we'll be able to travel and a lot of the world hopefully will change for the better. But until then, I think there's a lot to be learned. And like people have said, now with Zoom, the global world is now like literally in front of our screens, which is crazy. So for instance, some of these weekend calls for the Global OHS initiative, there's like 30 people from literally around the world calling in from Australia, South Africa, England, South America, Colombia. Like it's really amazing and really energizing after these meetings.
That's so awesome to hear, and surprising that you can get the people from Australia on the call. Dr. Stanford-Moore, do you want to talk about that? opportunities while we're all at home?
I mean, it's hard. I have a research block coming up next year, and I asked Mary the same question, like, oh, what am I going to do? But I think getting involved in research at your home institution, even something like a literature review on a topic that's interesting to you, I think that also kind of sounds lame to a lot of people that have done real research, but global health research is like 2 decades behind all other research. And so even doing a literature review of what's already available and saying what's not available can be super beneficial. So finding a mentor and a project to work with. I think something that's come up that I wanted to address is this concept of like, or people ask me like, should I take a year off? So I don't know if everyone on the call is a 4th year med student, but those who aren't, I think the answer is you don't have to, but if you do, it does open a lot of opportunities. I took a year off and did an MPH, and I specifically went to the UK to have more of a global health plug with colleagues there that do more work in sub-Saharan Africa. But no matter what you do in a year off, just having the time and flexibility to explore passions that take more time, I think that can be really well suited to someone who's interested in global health, and showing residency programs that it wasn't because you wanted to go on vacation that you did this mission trip, but you actually are serious about an academic career in global health or global surgery.
The last thing I'll add is, yes, it's pushed everyone as much as possible to, meet face-to-face via Zoom, which opens up a lot of doors. It still doesn't open up all the kinds of doors that we want to, provide access to. It's provided a remarkable opportunity to study the impact of, pandemics and governments on healthcare systems. And so a lot of healthcare systems around the world and countries that we work with and work in and partner with are having to look at the financing of their health systems. What does it mean to make decisions as to what procedures get covered? How do we control this from a top-down approach? And so a lot of those lines have been laid bare, and that's fraught at many levels, and it has made some things difficult. But a lot of people are looking at those kinds of data that's necessary to answer those questions. And so beginning to ask, well, what does it mean to provide healthcare in Belarus right now? And what does it mean to do these kinds of things as the world sort of boils a little bit? You can ask a lot of those kinds of questions now from home. And those are long-term difficult questions to answer, but there are people sort of working on those kinds of things as well.
Okay, and out of respect for time, because it's 8 o'clock, this will be our last question for the night. Is clinical research in ENT preferred over basic research or global surgery research in general? Do you guys ever find your global health research a hard sell in comparison to maybe some basic science research or clinical research of your colleagues? And we'll start with Dr. Zhu.
Yes, it's a hard sell. I don't know, that's curious what Gaelen and Isaac say, but I think it's a hard sell because as I was interviewing for fellowships, like I say, I'm interested in global health and global health research from an academic standpoint. And I always caveated, this is not the standard, like traditional R01 basic lab science research. I think this type of research is like, there's less groundwork laid, and so it just takes more time. I personally think, and I'm sure everyone on this call, it's very important and we need this kind of work. But yeah, for sure. I mean, I've definitely talked to, people around me that like, do real research or do like go to the lab or something like that. So it's definitely a harder sell. It's not traditional. And I think part of the reason why it's a harder sell and not traditional is because I think, like for me, it's hard to point to someone and be like, I want my career just like that. Like I want to run my clinic and I want to run my research and I want funding the way this person has it, because I think a lot of the probably people in this call are going to be the ones like figuring out that model of how do you do clinical practice, how do you do research, how do you get funding. And I think those questions are still like really up in the air for this like really developing field.
Absolutely. Dr. Stanford-Moore, did you have similar experiences at UCSF?
Yeah, I think kind of everywhere when you're interviewing places or talking to people, global health is seen as kind of like a fun vacation as opposed to something that's academically rigorous. I think what's been beneficial is doing research in other things also. I think as someone who's interested in research, it's nice to have mentors that are at home in your home institution doing and making those connections as well. So if you can do a bit of both, I think that you get the respect of being an academician, and then you can have your passion. And global health research takes a little longer. And so sometimes you can do projects like a little bit side by side or in between. We have an annual research symposium, I would say. And I actually talked to Mary about whether I would present some of my more classic clinical head and neck cancer research or some of the global health research. And I felt like it was nice I had both to choose from, so that if I wanted it to be like quote unquote prestigious, I had something to talk about. But I chose to talk about the global health research, and honestly, people found it much more interesting. It's nice to have something that's more unique that people don't necessarily think about all the time. But I think the most common question I get is, well, this is great, but how are you going to do this with your career? And I think a good answer is like, I'm going to figure it out. There's not a great model for it yet, but we have mentors from all over the world that make it work. And I think that we will be those people that can rely on each other to troubleshoot and make it work.
And I think the thing that makes it a little harder to sell is precisely the thing that makes it that much more interesting is it doesn't fit into an elevator pitch, right? Like in a lot of research that like you're going to be, talking about with your attendings and on the interview trail, they want the like two-liner behind it. And a lot of global surgery research doesn't have a two-liner that, is as impactful. It's pretty easy to summarize, a more standard clinical trial approach. Obviously it's inadequate, but it's the efficient way to do it. And global surgery takes time to communicate it. But when you have that space to communicate it and your passion comes through and you're able to bring this person along for this story, they get it for the most part. I mean, there are certain people who still might, roll their eyes, but they get it. You just need that time and space, which is not always there on the interview trail and in the sort of operating room as someone asks you a question, like, what are you doing? And but I think that's what I found to be why it's a little hard to sort of bring people along, but it's purely because it doesn't fit into an elevator pitch. And I'm quite proud about that.
Absolutely. Thank you guys so much for being on the call tonight and taking time out of your schedules to be here. I know that I and every other student on the call really appreciate it because we look up to you guys as forging this path for us in ENT and in global surgery alike. So we're all very, very appreciative of your guys' time and efforts in the Global OH&S initiative and all of that. So thank you again for being here. Everyone, this will be on our YouTube channel, so you can look back at it later. So don't feel like you need to take notes. Okay, have a good night, everybody.
Thank you.
Thanks, Sarah. Good to see you guys.
Hey, have a good one. Bye, Isaac.
Bye.